How to talk about medical topics to patients and their families like you're not a nerd. Today, let's talk about febrile seizures. Two kinds of febrile seizures. There's simple and there's complex. Let's start with simple. General tonic-clonic movements, flappy, upper, lower, eyes roll back. Stereotypical. When people think seizure, they think generalized seizure. Less than 15 minutes in duration, which is an obnoxious period of time to time a seizure, and one seizure episode in 24 hours. If they have two simple febrile seizures in 24 hours, it's more complex now. Those kids are admitted and they get more of a workup. If a kid has a simple febrile seizure, returns to baseline, what does that mean? They're walkie-talkie, they're feeling a little pokey because they're sick with something, they have a fever, but they can eat and drink and poop, and they're making wet diapers, and they're doing normal toddler baby things. But if they have more than one in 24 hours, or it's only a particular part of the brain, I tell families the brain does different things based off the area. So behind here, is their vision different? Are they having different sensation in the legs or in the arms? Are they having differences in balance or coordination? That is more complex. Those kids need some level of a workup, or to see a peds neurologist, or an EEG, or an anti-epileptic drug, or Keppra, or whatever. They get more of a workup. But these kids oftentimes can go home, which is usually not the easiest conversation to have with a family member who just watched their 1-year-old have a seizure. And then for me to say, everything is fine, go home, right? And there are three things that I mentioned. One is your kid, their fever is controlled. They're still acting a little pokey, but they're eating and they're drinking. They can tolerate orally. They're interested in the bluey artwork on the wall. They're acting more like themselves. Two, the degree of which a kid has a fever. They are not necessarily more likely to develop a febrile seizure again, whether you aggressively control and they're 100.5 for 30 minutes or they're 104 for 4 hours. It's been studied by people smarter than me. The more aggressively you control this, you're not necessarily going to avoid more febrile seizures. And then the third thing is, kids who have febrile seizures, it's very common, and they are not more likely to develop epilepsy as an adult or later in life. So oftentimes, a one-time off, simple generalized febrile seizure doesn't require neurology workup, doesn't require an EEG. I don't have to torture your kid and poke him for blood work. It doesn't require any of those things. And it's hard to fit this in a 3-minute video, but if you take the time to explain those three things, more often than not, they're going to be reassured. Usually I'll say something like, I'm so sorry to meet you this way. I can't imagine how scary it was to see your child have a seizure. But I'm happy to say, in a sense, that they are going to be okay. This is a common and easily managed thing the vast majority of the time for these reasons. This is simple for these reasons. It's not complex for these reasons. What questions do you have?